Have you noticed that your backside seems flatter than it used to be, almost like it's slowly disappearing year after year? Do you feel unsteady or wobbly when walking on uneven ground, going down slopes, or even just standing on one leg to put on your pants? And perhaps most importantly, have you started to believe that after 50, it's simply too late to firm up your glutes and rebuild the strength you've lost? I'm Dr. Michael Turner, and I've spent over 15 years helping adults over 50 rebuild their strength through safe, evidence-based exercise. Today, I'm going to show you 5 simple, no-squat glute exercises that you can do at home without any expensive equipment. Now, let's begin with exercise number 5, the standing hip extension. This movement is widely recommended in geriatric physical therapy programs and is included in guidelines from the American Physical Therapy Association as a foundational movement for older adults looking to strengthen their lower body safely. This exercise targets your gluteus maximus, which is the large, powerful muscle that forms the bulk of your buttocks. It's responsible for pushing your leg backward, which you do every time you take a step, climb a stair, or stand up from sitting. When this muscle becomes weak, walking feels more effortful, and you may lean forward more when you move. Strengthening it restores power to your stride and takes pressure off your lower back, reducing discomfort during daily activities. Stand behind a sturdy chair and place both hands on it for support. Your feet should be hip-width apart, toes pointing forward. Stand tall with your core gently engaged and keep a soft bend in your supporting knee throughout the exercise. Never lock your knee completely straight, as this can cause unnecessary joint stress. Shift your weight onto your left leg while keeping both hands on the chair for balance. Now, slowly extend your right leg straight back behind you, leading with your heel. Imagine pressing your heel into a wall behind you. Focus on squeezing your right glute muscle. You should feel the contraction in your buttock, not your lower back. Lift only as high as you can while keeping your torso upright, usually 6 to 12 inches. Do not lean forward or arch your back to lift higher. The quality of the squeeze matters far more than the height of your leg. Hold the top position for 1 to 2 seconds while maintaining that glute squeeze. Breathe out as you lift. Breathe in as you lower with control. Do not let your leg drop or swing down. Complete 8 to 12 repetitions, then switch legs. Start with 1 set per side and progress to 2 sets as you get stronger over the coming weeks. The most common mistake is leaning forward while lifting the leg. Keep your chest proud and spine neutral throughout the entire movement. Another error is lifting too high by arching your back. If you find yourself arching, lower your leg immediately. Also, avoid rushing through the movement. Take 3 to 4 seconds per repetition to ensure proper muscle engagement. If balance is limited, try this with your back against a wall for extra support. You can also reduce the range of motion initially. Once it becomes easy, add a light ankle weight, starting with 1 to 2 pounds, or increase the hold time to 3 or 4 seconds for greater challenge. Exercise number 4 is the side-lying clamshell. This exercise is one of the most studied glute movements in rehabilitation research. Studies from the University of North Carolina and guidelines from the American College of Sports Medicine highlight its effectiveness for targeting the gluteus medius with minimal joint stress, making it ideal for those with knee sensitivity. The gluteus medius is the muscle on the outer side of your hip. It keeps your hips level when you walk, prevents you from swaying side to side, and helps you balance when standing on one leg. Weakness in this muscle is a leading cause of falls in older adults and is often connected to hip and knee pain during everyday activities. Lie on your right side on a comfortable surface such as a yoga mat, carpet, or even your bed if getting to the floor is difficult. Stack your hips directly on top of each other so you're not rolling forward or backward. Bend both knees to about 45 degrees with your heels in line with your buttocks. Rest your head on your arm or a pillow for comfort. Place your left hand on your hip to feel the muscle working and monitor for unwanted movement in your pelvis. Engage your core slightly to stabilize your spine and pelvis. Keeping your feet pressed together, slowly rotate your left knee upward toward the ceiling like a clamshell opening. Your feet stay touching as a hinge point throughout the movement. Focus on the contraction in your outer hip. You should feel it on the side of your buttock, not the front of your thigh. Open only as far as you can while keeping your pelvis completely still. If your top hip starts to roll backward, you've gone too far and need to reduce the range. Hold for 1 to 2 seconds, squeezing the outer hip firmly. Breathe out as you open, in as you close. Lower with control, never letting gravity do the work. Complete 10 to 15 repetitions, then flip over and repeat on the other side. Start with 1 set per side and progress to 2 sets. The biggest mistake is letting your pelvis roll backward as you lift your knee. Keep your hand on your hip bone to ensure it doesn't move at all. Also, avoid using momentum to swing the knee up quickly. Move slowly and deliberately for maximum benefit. If lying on your side is uncomfortable or causes hip pain, try this on your back with knees bent, letting them fall gently outward. To make it harder, place a light resistance band around both thighs just above your knees. Exercise number 3 is the glute bridge. The glute bridge is a gold standard exercise featured in clinical guidelines from the Mayo Clinic and American Physical Therapy Association for hip and lower back rehabilitation. It's one of the most prescribed exercises for older adults. This is one of the most effective knee-friendly exercises for targeting the gluteus maximus in a safe position. It strengthens the muscles that help you stand up from sitting, climb stairs, and maintain upright posture throughout the day. Many people with chronic lower back discomfort find that regular practice actually reduces their pain significantly over time. Lie on your back on a comfortable surface. Bend your knees so your feet are flat, hip-width apart. Position your feet so your fingertips can just touch your heels when arms are by your sides. Toes point forward, not outward. Rest your arms by your sides with palms facing down. Head and neck should be completely relaxed against the surface. Engage your core gently as if preparing for someone to tap your stomach. Press your feet firmly into the floor, driving through your heels rather than your toes. Squeeze your glutes and slowly lift your hips until your body forms a straight line from shoulders to knees. Don't lift so high that your back arches excessively. Your weight should rest on your shoulder blades and feet, never on your neck. Hold for 2 to 3 seconds with a strong glute squeeze at the top. Breathe out as you lift, in as you lower. Lower slowly with control, don't drop quickly. Complete 10 to 12 repetitions. Start with 1 set and add a 2nd set as you get stronger. Common errors include lifting too high, which strains the lower back, letting knees fall inward toward each other, and driving through toes instead of heels. Focus on keeping knees aligned with hips throughout and pressing firmly through your heels for proper glute activation. If this is challenging initially, reduce your range of motion and lift just a few inches off the ground. For progression, try the single leg version by extending one leg straight out, so only one foot remains on the floor. This significantly increases the challenge. Exercise number 2 is the standing side leg raise. This exercise is included in fall prevention programs from the Centers for Disease Control and Prevention and recommended by geriatric specialists at Johns Hopkins Medicine for improving lateral hip strength and balance in adults over 50. This targets your gluteus medius while adding a balance challenge that closely mimics real-life situations. Strong hip abductors help you maintain balance when walking, prevent falls when pushed or jostled, and reduce knee strain by keeping your legs properly aligned during movement. Stand beside a sturdy chair with your right hand on it for balance. Feet together, posture upright with shoulders back, core gently engaged. Keep a soft bend in your supporting knee throughout. Shift weight onto your right leg while maintaining that gentle knee bend. Keeping your left leg straight with knee soft but not locked, slowly lift it directly out to the side. Lead with your heel and keep toes pointing forward, not up toward the ceiling. Initiate the movement from your outer hip, not by leaning your upper body away to compensate. Lift only as high as you can while keeping torso completely upright and hips level, usually 6 to 12 inches. Hold for 1 to 2 seconds, feeling the contraction on your outer hip. Breathe out as you lift, in as you lower. Lower slowly with control, never letting the leg drop. Complete 10 to 12 repetitions, then switch sides. Start with 1 set per leg and progress to 2 sets over time. The most frequent error is leaning away from the lifting leg. Keep shoulders and hips level throughout, as if standing between 2 panes of glass. Another mistake is rotating the leg so toes point upward. Keep toes pointing forward or slightly down. For more support, use both hands on the chair or stand with back against a wall. To progress, add a light ankle weight or try without holding anything for an added balance challenge. And now, exercise number 1, the seated glute squeeze. Isometric glute contractions are recommended by physical therapists at the Cleveland Clinic and commonly used in early-stage rehabilitation programs for patients with mobility limitations or those recovering from surgery. I've saved this for number 1 because it's the most accessible and most important for building mind-muscle connection with your glutes. Many people over 50 have lost the ability to consciously contract these muscles because years of prolonged sitting keep them stretched and inactive. This simple squeeze wakes up the neural pathways between your brain and your glutes. Once you master this fundamental skill, every other glute exercise becomes significantly more effective. Sit on a firm chair toward the front edge so your back isn't resting against the backrest. Feet flat on floor, hip width apart, knees bent at approximately 90 degrees. Sit tall with good posture, shoulders back, chest open and proud. Bring your attention to your glute muscles, the muscles you're sitting on. Without moving your legs or back at all, squeeze your glute muscles together as hard as you can. Imagine you're trying to crack a walnut between your buttocks. You should feel both sides tighten and firm up noticeably. Your pelvis may tilt slightly forward and your spine may lengthen, which indicates correct engagement. Hold this squeeze for 5 to 10 seconds, breathing normally throughout. Don't hold your breath during the contraction. After holding, slowly release over 2 to 3 seconds rather than letting go abruptly. Rest briefly and repeat. Complete 10 to 15 repetitions for 1 to 2 sets. Many people mistakenly squeeze their thighs together or tighten their abdomen without actually engaging their glutes. To check proper form, place hands under your buttocks while sitting. When you squeeze correctly, you should feel the muscles firm up and push against your hands. If you can't feel the contraction while seated, try lying on your back with knees bent. This position often makes it easier to isolate the muscles. To progress, increase hold time to 15 or 20 seconds, or perform while standing for an added challenge. Now let me show you how to combine these 5 exercises into a complete no-squat glute routine. Start with 2 minutes of walking in place to warm up and get blood flowing to your muscles. Then perform the exercises in this specific order. First, seated glute squeeze for 12 repetitions, holding each for 8 seconds to activate your glutes. Second, glute bridge for 10 to 12 repetitions with 2 to 3 second holds at top, rest briefly, then repeat for a second set. Third, side lying clamshell for 12 repetitions on each side. Fourth, standing hip extension for 10 repetitions on each leg. Fifth, standing side leg raise for 10 repetitions on each leg. Finish with 2 minutes of gentle stretching or slow walking to cool down. Perform this complete routine 3 times per week, with at least 1 rest day between sessions for recovery. Total time is approximately 12 to 15 minutes. For progression over the coming weeks and months, spend weeks 1 and 2 focusing entirely on proper form using simpler variations if needed. During weeks 3 and 4, add a second set to each exercise and increase repetitions by 2 to 3. From weeks 5 through 8, add 1-pound ankle weights to standing exercises and use light resistance bands for clamshells and bridges. After week 9, progress to heavier weights, medium resistance bands, and try single leg bridge variations. Never increase more than 1 variable at a time. If anything causes pain, step back to the previous level immediately. You won't see dramatic changes in 1 week, but improvement absolutely happens with consistency over time. In the first 2 weeks, you'll feel your glutes working more during everyday activities as your mind-muscle connection improves. By weeks 3 and 4, exercises feel easier and your balance improves noticeably during standing movements. After 6 to 8 weeks of consistent practice, you'll notice meaningful functional improvements. Standing from chairs becomes easier, stairs feel less challenging, and balance on uneven surfaces improves significantly. Over several months, you'll see visible muscle tone changes and significantly better overall stability. Consistency matters far more than intensity. Small, regular efforts compound into meaningful change over time. You are absolutely not too old for this. Your body still responds and adapts to exercise at every age when given the proper stimulus. If this video helped you understand these exercises better, please hit the like button below. Your likes help this video reach more people over 50 who are searching for safe, knee-friendly glute exercises they can do at home. Subscribe to this channel for more over 50 fitness content and safe strength routines designed specifically for your needs. Share this video with a friend or family member who has given up on squats due to knee pain. These exercises could be exactly what they need. It's never too late to start building stronger glutes. Every journey begins with a single step. Start with just one exercise if that feels manageable for you right now. Do it 3 times this week and build from there. Small, consistent actions lead to remarkable results over time. In just a few months, you could have noticeably stronger glutes, better balance, and much more confidence in your daily movements. Thank you so much for watching. Take care of yourself, listen to your body, and I'll see you in the next video.